Meeting of the Central District Board of Health meeting for Friday, April 15th, 2022. It's now 8:30 a.m. I will take roll call, call the meeting to order and roll call by county, starting with Ada County. Dr. Young.
Jane Young here.
Thank you. Raul Labrador.
Here.
Dr. Cole. Boise County, Commissioner Sturm.
Here.
Elmore County, Representative Blanksmont.
Here.
Valley County Commissioner Hasbrook.
Present.
Okay, thank you, folks. We do have a quorum, so we will proceed with the action items. Director Duke, are there any changes to the agenda?
No changes to the agenda, Madam Chair.
Okay, thank you. Next on our agenda is our in-person public comments. And each person that has signed up wishing to speak has a maximum of 3 minutes to present their case. So let's see, we'll start with the first person on the list, Dr. Ann Hike.
And where do I address you?
Right there at the podium. Thank you.
Okay.
All right, my name is Dr. Ann Hike. I'm a medical doctor. I've done emergency medicine for over 30 years, and I have my own integrative health practice for I've done that for over 30 years as well. In my practice, I've had patients who have had illness from electromagnetic radiation. These people did not consent to this technology. This technology has not been instituted by taking into effect the medical environmental concerns. All new technologies must be scrutinized for harm to humans and the environment. Wireless technologies cause harms to pets, farm animals, pollinators and bees, other insects and plants. There are over 20,000 studies on the subject. Lead and asbestos were both discontinued with less than 10,000 studies. Harms to humans include, but are not limited to, neurodegenerative diseases. That includes autism, ADD, Alzheimer's, dementia, depression, insomnia, also arrhythmias, there's slow heartbeats and fast heartbeats, and cardiac arrest, resulting in death, even in children, and cardiomyopathy. There's infertility, including decreased sperm production and egg production, and increased miscarriage rate. There are breaks in cellular DNA, that's code word for cancer. There was a study done by Ronald Melnick, $30 million study asked for by the government using 20 years worth of rodents. And the results of the study were available in 2016. This was done through the National Toxicology Program. The study performed experiments below the thermal effects outlined as safe by the United States government. The study showed an increase in heart tumors, brain tumors, enlarged cells, and DNA damage. This should result in mandatory cessation of the technology, as happened with asbestos and lead. Hank Allen, who's sitting here, will be telling us about his heart problems. He asked his doctor, well, what's the cause of this? And the doctor said, I'm not paid to tell you the cause. I'm not paid to investigate the cause. He said he didn't know, and his job was to treat the symptoms. So if doctors won't take action and the city of Boise won't take action to protect its citizens, who will? I propose a moratorium on all new cell phone towers until they are proven to be safe. It is outrageous. We do not have the effective radiative power of any of the powers in Boise. This needs immediate attention. If not now, then when? If not you, then who? Step up and protect us. Thank you.
Thank you, Dr. Hyde. Okay. Barbara?
I'd like to just pass these around before I start here.
I'm partially, is that?
Partially, yes.
Partially, okay, thank you.
Okay. I'm going to speak on a different aspect of this. From the insect point of view, we know that honeybees are dying, and we know insects are very important to us in life. I've worked as an entomologist for many years. I work at a farm now, a church farm over in Caldwell, and I've done this for many years. I study insects. I've done a lot of conferences. I've done a lot of research with them. Insects are important to our lives. The honeybees, for instance, are the pollinators we need to produce food. The radiation from the cell phone towers influences the honeybee's behavior and physiology. When exposed to electromagnetic radiation, it's been shown that there was reduced motor activity of the worker bees in the comb, mass migration. We need them staying on the farms, quite frankly. The bees also became aggressive. These are honeybees. I work around honeybees. I walk through them all the time. They're not aggressive, but they become aggressive around this stuff. They experience loss of life. The picture I'm sending around is somebody who has a bee colony. I mean, they're raising honeybees, and the 5G tower went on, and they're all dead. You can look at them; they're all dead. It kills bees. I have talked to one of the inventors of 5G. He said, yes, they will kill insects. In fact, there is research being done on how to kill insects we don't want using 5G. But if we kill off all the insects, you're not having food. Just letting you know. It also reduces the hatching of the queens. Let's see, gives them problems returning to the hives. It results in massive loss of worker bees. Based on available information, it's expected that with increased electromagnetic radiation, we should expect honeybee losses relative, well, you would know, relative to the beetles and the wasps. All those insects that are actually beneficial to us are going to be gone. At the end of one experiment, when compared to bees that were not exposed to high EMFs, the honeybees that were exposed produced less honey. So we also were just going to reduce the amount we have there. It affects their weight, their survival, everything. So, you're killing this stuff off, and if you allow this. Now, there is a way around it. I am totally for a moratorium, such as Dr. Hyde has mentioned, because I think we need to have more research on this, and we need to show that it's safe. But at least, if we're not willing to do that, at least Texas and Florida seem to have these towers, but they're not having the problems we are. The reason is they have them 200 feet in the air. We have them much lower. So if you're not willing to really step up and do a moratorium on this until we can show safety, please consider requiring them to be high enough up so that they're not killing the insect life and affecting the health of the people and children. I thank you.
Thank you. Vivian, is it Lockhart? Lockery, okay.
Good morning, everyone. Thank you. I come before you to report on a bold action taken by the Pittsfield, Massachusetts Board of Health. And I sent an email with the information out to the board earlier. They issued a cease and desist order to Verizon to shut down one of its towers. It was families living in the neighborhood near the tower that reported wireless radiation-related health issues soon after the tower was put in operation in 2020. And affected residents had a number of serious issues, medical issues, including nausea, vomiting, tinnitus, dizziness, insomnia, and more. They reported the symptoms to the city authorities and the Board of Health over years requesting relief. Several of the residents sold their homes and left the community because they found the area uninhabitable. Other residents have been living in their cars or staying with relatives. Pittsfield board member Steve Smith stated, as a member of the board, I'm here to safeguard the health of residents of the city of Pittsfield. So on some level, for me, win or lose this long battle with a company that's going to look at this on a global scale, at some point, I'm going to have to sit back 20 years later and say, did I do everything I could to safeguard the residents in Pittsfield when I was in that position, or did I not? I guess that's the way I have to think about it. I ask you to take this same vein. What we're presenting here about wireless radiation is quite possibly the canary in the coal mine, and it really behooves individual board members to educate yourselves on this topic. I understand that to understand the harmful effects, all the research behind it is like drinking from a fire hose. At least that's the way it was for me. And I'm a public health and clinical lab scientist, retired. But wireless radiation was not my specialty. I have a booklet here that I believe I have enough for all board members, all 8 of you. And it has some great history, great background, a plethora of research, I just want to share with you, in 1982, the EPA's Office of Radiation Programs, which had been studying the non-thermal effects of wireless radiation for a decade, announced that it was developing a federal guidance to limit the public's exposure. But before the agency was able to develop and implement those guidelines, its authority to do so was rescinded and the office was defunded. So it's in the hands of the FCC, who has refused to update 25-year-old guidelines for wireless radiation. I thank you for your time. It's wonderful to see everybody in person.
Thank you. Thank you, Ellen.
Hello. Thank you for letting us come and speak to you today. So I'm Hank Allen, and I live at 687 West Rush Court out of Eagle. And I'm here begging for your help. I really need the Board of Health to help out. So back almost 3 years ago, after I bought or 5 years ago, I bought a farm out in Eagle and moved my family out of California. We came out here, and I specifically found a farm where I was far away from cell towers, and moved to the house. And within 2 years of moving in, I got a notice from Verizon that they wanted to put a cell tower about 600 yards behind my house. And knowing what happened to me in California, I was exposed to the radiation. We formed a neighborhood group and tried to oppose this cell tower. And we were successful. We went to Ada County. We had the commissioners from Ada County all agreed that the cell tower was too close to homes and it wasn't in the right location. And they voted to deny the application for the cell tower permit. Well, the tower provider, they came back and sued the Ada County and demanded they put the tower in. So Ada County installed the tower. It was turned on back in April of 21, so almost a year ago. And within a week of it being turned on, I go into AFib. I'm up in the second story bedroom of my house, and I go into AFib. I've never had heart problems. And I started going to AFib. I went into AFib 5 times within April, May, and June. Finally, in June, I put up shielding on my house. I painted my house and put up screens over my windows to protect myself and my family. And I didn't have AFib. As long as I stayed in the house, I didn't go out. I'm on 2 acres. I go out to feed my animals. As long as I was protecting myself, I wasn't going into AFib. So I thought I'd kind of done this at great expense to myself, until I was traveling out into the foothills out in Hidden Springs. I went to dinner at a friend's house. He said he was having some issues. And I took my meters out to check his house out. He lives right next to the cell tower. I walked into his house. Within 5 minutes, I'm an AFib. And that was about 4 months ago. So I've been to my cardiologist. 3 weeks ago, I just got out of surgery. I had an ablation surgery done. And that seems to be keeping me out of AFib. But before all this stuff started, I noticed going through town, whenever I get close to these cell towers, it throws me into AFib. And there's no one else out there to protect. I put out a notice to other people in our community, and I have over 20 people. They're all saying that they're doing the same thing. They're going at AFib at random locations. I started mapping these locations, and they're all in close proximity to these cell towers. I was talking to the electrocardiologist. Can you give me an extra minute? Do you mind?
Briefly.
Right. My electrocardiologist at St. Luke's says they have a backlog of over a year of people waiting in line to get ablation surgeries. And it's a major, major concern. I sent a letter to you folks last month to look at with all the backup information. And I really need the Central Health Department to help in figuring out how to make these things safe. Not get rid of cell towers, but there's ways to make them safe, like we discussed, like raising them higher so that the radiation levels aren't so bad. And it's causing a lot of harm to myself and other people in our community. If you have any questions?
Just real quick.
Yeah.
Cell phone tower is a 100-foot tower, or was it a 200-foot tower? Where by your house in
Well,
Eagle?
my house is only 65 feet.
Yeah,
My
that,
house is up on a
Hill.
hill.
So
that seems like the solution to me is change the P and Z. The ordinance says you gotta do a 200-foot tower if you're gonna go to 5G.
Yeah. and-
It's just an idea.
Yeah, or reduce the power somehow or another. We've got these technologies that I've seen that different the other places in the country that are affecting things. Yeah. Um, like Massachusetts and other states around the nation have figured out that there is a problem. And we just need to figure out how as a community, we're going to figure out a design to make this work for the insects, us, and be able to offer cell phones. Can't have our cake and eat it too.
Thank you.
Thank you.
Yep, absolutely.
Lynn Lair.
Dr. Paul, I think. Phone, I don't know, he says he can't get through on video, but I think he's on the phone.
Dr. Cole, are you there?
I'm here. Can you hear me?
Yes, we can. Thank you. Welcome.
I'm just trying the computer and it's still not letting me log in. So I will be here by phone. I apologize. Thank you.
Okay, thank you. Okay, Lynn Lair?
Hi, thank you. I'm Lynn Laird. I'm in Ada County. And I just want to thank everybody who's spoken already. That is a concern of mine as well. Unfortunately, it's not something I'm super educated about. I don't feel I can speak very intelligently about it. So today I'm actually here to speak more about the proposed policy to be having the board review policies related to COVID that affect minors. And so I submitted an email yesterday explaining my concerns from a systematic perspective. And I really hope that you've all taken the time to look that over. Because I think, honestly, that's probably even more important than what I'm going to say today, although what I have to say today is important too. That's why I took the time to come here. Anyways, I've seen and experienced personally and firsthand the effects of some of these policies that have been put out, whether directly by Central District Health, or whether they're policies or whether they're recommendations, where things are being implemented throughout the community that are impacting our children, especially at schools. But I do hope, and I think I said this in the email, that you will consider even expanding that policy to take a look at all the policies put forth, because things don't just affect children. Some of the things that I have been seeing in my practice and in my personal experiences with my children and their friends is a real big increase in depression, anxiety, suicidality, bullying, social problems at school, academic issues happening at school because of a lot of the policies that have been put in place. I've seen a lot of people being, and myself included, feeling very disenfranchised. I can't wear a mask, so I've not been able to come to these meetings. So I've been kept out of the public sphere. And this to me is a very fundamental right. I don't like public speaking. I don't like having a camera in front of my face, but I think it's important, and that's why I'm here. And so I should be able to do this, whether I can wear a mask or not. And a lot of people will comply and they will submit, but I want you to think about even using those words. They don't speak of freedom at all. And I think it's really important for people to be able to take their own health measures that they choose. And if people want to wear a mask because they think that helps them, that's great. Other people can't for lots of reasons, for medical reasons, for psychological reasons. And I think that that's one of the things that really has been neglected in when these policies are being considered, whether it's, wearing masks or social distancing or shutting down schools, that people aren't, it seems as if the psychological impact of those policies are not being taken into account. So, thank you.
Peggy Carter.
I've seen you before.
So I'll be sitting in the middle.
I brought props this time. Buenos dias, good morning. It is my privilege to be able to speak this morning. My name is Peggy Carter and I live in Boise, and I represent myself. I support the board approval proposal for COVID-19 guidance issued by the CDH that impacts people under the age of 18. As a teacher and an advocate for children, I base my decisions on two questions. What is in the best interest of children? What does my experience, research, and the data tell me when I make those decisions? I want to look at some data this morning. The first piece of data I want to look at is the CDC recently changed the language milestone for 2-year-olds from 50 words at 24 years of age to 30 words at 24 years of age. That is a decrease of 40%. I can tell you my opinion, but I want you to think about what your opinion is. Is this progress or is this regression? Why is the CDC changing the norm versus investigating the cause? Are these policies beneficial or detrimental to a child's development? What do you think could be contributing to this change in norms? Is this in the best interest of children? What is the domino effect when we decrease by 40% at 2 years old, the language milestone? What will that domino effect be for early intervention, Head Start? What will happen to early learners with reading if we have decreased this margin there? How will that affect our educational standards? The second piece of data that I want to look at is, we know masks limit oxygen to the brain. The re-inhalation of our exhaled air will without a doubt create oxygen deficiency and a flooding of carbon dioxide. We know the human brain is very sensitive to oxygen deprivation. The acute warning symptoms are headaches, drowsiness, dizziness, issues with concentration, slowing of reactions of the cognitive systems. How do masks affect children's ability to learn? What are the long-term effects to the brain when it is deprived oxygen for possibly 6+ hours a day, 5 days a week for months on end? And in this particular case, we've done it for several years. What happens in the course of a school day after a child has a mask on and has been oxygen deprived for hours? How do children feel by the afternoon? How effective is their learning? Can I finish? Children and teens have 99.997% survival rate with COVID. It's extremely unlikely that they are going to transmit this disease. Are children the target of this disease? Why are we masking if they aren't sick and aren't transmitting COVID? What messages are we teaching children when we require them to wear masks? How are we conditioning children when we require them to wear masks? In my experience, it is essential that we reflect and learn from our experience. I do it all the time, as you do all the time, as a teacher, as a cook, as a quilter. When we're buying cars, we are constantly researching and getting our best, learning from what we know. What went well? What can we improve? Where can we gather more information? I believe it is critical to step back and reflect on the policies in place over the past year. What went well? What do we want to continue and repeat? What parts of this, if any, need revision or removal? What resources can we use to improve our effectiveness? I appreciate the hard work that the Department of CDH did over the past 2 years during this crisis. I believe you did your best. That said, I encourage the CDH to reflect and assess the effectiveness of the policies put in place and the resources used to base those decisions. I challenge the CDH to expand the research and data to include all science, both nationally and internationally, on the effectiveness of masking of children. How can children benefit from expanding our research pool to include breadth and depth? And I'm going to give you an example. Sure. If we were drawing a picture, right now we might be using all of these crayons. What would happen if we included all the data and we used all the crayons in the box? How much more breadth and depth would we have if we included all the data that is out there so that we can make an informed decision about how masking is affecting children? It is my recommendation that we step back and we reflect. This is not about pointing fingers. This is about learning from what we know so that we can do better. I want to end with a quote from Maya Angelou. Do the best you can until you know better. And then when you know better, do better. I want to thank Russ Duke and his department for all the service that you provided to us, and for all the board members that are sitting here who really, really make a difference. And what you do matters. Thank you.
Peggy Carter.
I have to pick up my toys and leave.
My name is Sandy Carden, and I would like to thank all of you for allowing me to speak today and for all of the hard work that I know everybody does here every day. I would like to support a change in CDH policy which would require board approval for COVID guidance for minors. Currently, CDC can issue any guidance or change any metric without justification. CDH passes those guidelines along to schools in closed-door meetings, and some schools turn them into mandates with the force of law. So we have unelected public health employees on the other side of the country with no knowledge of or interest in our youth, setting long-lasting and far-reaching policy with potentially dire and long-term ramifications, and they bear no responsibility for the consequences of their decisions. Therefore, having an extra layer of oversight and accountability by the CDH Board of Health is imperative on this issue. I'd like to share a few stories. I believe these stories to be minor in comparison to what some children have suffered under the COVID guidance of the past 2 years. The first one occurred spring 2021. My daughter had a mild tummy ache and vomited once on a Thursday evening. I kept her home the next day and was informed by the nurse she would have to quarantine for 10 days or produce a negative COVID test. It was Friday afternoon. My daughter was completely back to normal. I drove to the testing facility and was informed that her symptoms did not qualify her for a test. One emotional meltdown and 2 supervisors later, they administered the test, which was, of course, negative, and she was back to school on Monday. In that case, the CDH illness guidance to schools did not match the illness requirements of the testing facility. The second story I'd like to share is for another child. Online school was very hard for my other daughter. She would get overwhelmed and have meltdowns on most days that sometimes lasted hours. As a result, I was willing to do anything to get her back to school in person, and at the time didn't care if that meant wearing a mask. It wasn't until she was back 5 days a week that I noticed she would come home nearly every day with headaches and sometimes also with nausea. She told me she couldn't understand her teacher or friends and felt lonely even though she was surrounded by her peers. Furthermore, she graduated from a year of twice weekly speech therapy right as COVID hit, but started to regress once she went back to school full-time wearing a mask last spring. We spent much of last summer recorrecting her speech, but she's regressed again over the course of this school year. Since the mask mandate has now been lifted for the foreseeable future, she's back in speech therapy, but it's not sustainable to regress in speech or other academic or developmental areas every year because the CDC decides it's time to put on a mask, quarantine when you aren't sick, cancel activities, or go to remote learning. Speaking of activities, the restrictions were very different depending on age and activity. Whenever pressed, the school district always said they were following CDH guidance, so I'm not sure if the inconsistencies came from CDH or within the school district. For example, secondary choir students had no singing restrictions all year, but elementary music was limited to 15 minutes of singing per class period until last month. Secondary indoor volleyball took place last fall, but elementary basketball was postponed. Elementary basketball players were required to wear masks during play for part of the season, but no such requirement existed for secondary players. Spectators attending secondary sporting events were allowed to unmask, but masking was strictly enforced for elementary games. America's children were granted normal childhoods through polio, measles, chickenpox, and more, but shouldered an outsized burden for an illness less dangerous to them than the seasonal flu or pneumonia. It's our job as adults to protect our children, not the other way around. And my hope is that this policy change will provide more balance and oversight to the system than we've seen the past 2 years. Thank you.
all those who share their knowledge, and we're going to go ahead and now we'll proceed on with the new business. We will vote on the minutes from our March 25th board meeting. Are there any corrections or additions to those minutes? Hearing none, I will call for a motion for approval.
Madam Chair, I'll make a motion.
Thank you, Al.
I'll second it.
Okay, thank you. No further discussion. I'll call for a vote, starting with Ada County, Dr. Young.
Aye.
Raul Labrador,
Aye.
Dr. Call,
Aye.
Boise County Commissioner Sturm,
Aye.
Elmore County Representative Blanksma. Aye. Valley County Commissioner Hasper.
Aye.
Okay, thank you, folks. Those minutes have been approved as presented. Laurel McMahon, our Financial Report Services Division Administrator, will bring us up to date where we stand.
Yes, good morning, everybody. Good to see everybody in person. It's only the second time I've been able to present in person, so I'm really excited to be able to see everyone and talk this morning. To start with, and Dustin should be pulling up the presentation, but I just wanted to extend a thank you to Bailey Peterson for presenting on my behalf last month when I was able to take a small vacation. Thank you to Bailey. What you see up on the screen right now is actually not the starting point. That's page 3. We should be going to page 1 in just a second. Here we go. We've got the budget to actual report, which represents our revenues and expenditures through March, 75% of the fiscal year. Really, overall, there are no new trends to report. We've continued on the same trajectories that we've been on throughout this fiscal year. I know it's small to see on the screen. You have it in front of you as well. As an overall summary, you can see on page 1 that our revenues are at 85% of budget of what we planned, and expenditures are below what we predicted to spend at this point in the year, coming in at 67%. To go into a little bit more detail on our revenues thus far, as you can see, as normal, administration and support services don't have fees or contracts, and the other revenue that you see there is still the same thing we've been seeing throughout the year. That's the vehicle sales and rebates. We don't anticipate any more coming in, but it was a little more than what we planned for the fiscal year overall. Some of that is a little hard to predict. For community and environmental health, our fees are at 87% of budget. That reflects the high volume of food establishment fees and inspections that are being done, again, similar to what we've seen throughout the year. Contracts are high there as well. That's where you see the COVID contracts and funding show up. Other is higher than planned, and that's where we see the WICC included, Millennium Fund, and our CRP show up in that category as well. If we look at FCS, you can see that fees are still slightly below our planned amounts. Again, that's consistent with what we've been seeing throughout this year. Contracts are high, and what makes it high there in the FCS division is the COVID vaccine equity grant. Other revenue is high, and that's where our home visitation funds show up. Looking at expenditures for administration, both personnel and operating are below the budgeted amounts. For support services, our personnel is right on track, exactly where we expected to be. Our operating is fairly close to what we planned, and capital is approaching what we plan to spend for the whole year. For community and environmental health, personnel is below planned, operating is on track, and the same for FCS, for family and clinic services. And just a brief note here, as you can see, with all of our personnel expenditures being behind the planned amounts at this point in the year, we do anticipate if we continue at the same rate that we will have a carryover with our personnel funds into next year. And that the reasons for that are similar to what they were last year: continued charging to COVID grants, continued position vacancy for just a few positions, but some that we planned, and then there have also been some key retirements. Looking at page 2, moving on to that, I know everyone flipped it, and Dustin will be too. So this is our comparison for this point in the fiscal year compared to the 2 previous years. Here we see what we just saw on the other page with the continued fee trends, and CEH fees continue to grow annually. The biggest increase you can see again being in food program fees. For the FCS division, see what we saw last time, an increase in central care. Immunizations have decreased compared to the past 2 years. reproductive health fees have surpassed the FY20 amounts and are on track to match last year's amounts. And that's been a fairly recent rebound over the past couple of months. Our child dental clinic is also rebounding, but not quite where we had been previously.
Can I stop for just a
Yeah,
second?
yes.
Yeah, can you tell me why the land programs dash other is nearly double? What's included in that?
So land programs are the services that we provide in community environmental health for land. Those are the inspections and Jamie,
Septic
can you
permits.
septic
Thank
permits?
you.
They're increasing dramatically
Just,
throughout our.
so development is what's doing it?
Yes.
Okay.
There's growth in Idaho?
It's made up. Fake news. Fake news, yeah.
Go ahead, Laura.
Okay, thank you. Moving on to contracts in community environmental health, you can see that we're very close to where we were last year. And both of those are a big increase since fiscal year 20, and that is where the COVID funding shows up. Looking at expenditures, as you can see, as we mentioned on page 1, that our personnel costs are under what we expected, and operating is over. Capital is above what we originally planned when we proposed the budget last year, but it's within the planned projects that we designated from carryover funds last year. And then we can move on to the cash balance statement. And I will go straight to our special projects carryover designation from last year. We continue to see some spending in this area, but not as much as what we planned when we asked for those carryover designations. Just looking at the completion of the remodel, we've spoken with the contractors for new furniture and the remainder of the remodel, but that has not begun yet, so that's why that amount remains unchanged. For IT operating funds that you see there, that's mostly been what we spent on Office 365. We do have a couple of planned things to continue spending that money through the end of the year. The facilities, maintenance and service projects and modernization is about half spent overall. And then the grant writer salary costs are under what we'd hope, but will continue to be spent down. We do have a great grant writer in that position there now. We had a vacancy for a couple of months. The cash balance at month end, less the reserve fund, leaves us a balance of $3 million in the undesignated cash balance. That will come down slightly before next month because there are 3 payrolls in April.
Another question.
Go ahead.
The family clinic services marketing campaign,
Mm-hmm.
you have 100,000 sitting there, 5,000 has been spent.
Mm-hmm.
Is all of that necessary?
We have just completed paying the contractor for the plan for the marketing campaign. I'm not sure what the estimated cost of the campaign plan that she's developed is. Gina may have that number, but we're ready to begin implementing the plan, I believe, like immediately.
Can you tell me what the range is?
Ranges are not, they were not included. Purchasing like Facebook ads or if it's display marketing, media, so she wasn't able to give us.
Okay.
And your question,
Yes, go ahead, Al.
Laurel, under the cash balance, you said you got three more pay periods. What's that roughly?
3 pay periods in the month of
3
April. It's about 375,000 per pay period, is what
Per
we
pay
spent.
period,
Mhm.
okay.
Yes.
So about 1.5 million of that will be gone.
Less than that, but. And that is the summary of my report. So for any questions, any additional ones?
Any further questions or discussion for Laurel? Hearing none. Thank you, Laurel.
Thank you.
Thank you.
Okay. Next on our agenda is a review and vote on the proposed budget by Russ Duke. So Russ, you want to lead us into the budget discussion, please?
Sure. So you have in front of you the proposed budget for fiscal year 23. And today I'll review it with you, answer any questions you have, and then between now and May 20th, I will be going out and visiting with each of our boards of county commissioners. And you all have been invited for your respective counties, or you'll be there anyway because you are a commissioner. And then on May 20th, we will meet in Horseshoe Bend. And the budget committee, which is the chair or their designee from each county, will meet to discuss the budget. So whatever you approve today, to approve a budget, that is what will be presented on May 20th. So to start, I'll walk through it. Certainly if you have questions or edits, this is a draft, it's a proposal, and we can make those changes following the meeting. So when we met on March 25th, I had asked you to consider a 4% increase from our counties. And of the entire budget, that's pretty much the one item that's, I guess, more up for discussion than any other component. You had asked for 3 budgets, which would be 3%, 4%, 5%. So as I explained in an email I had sent to you, the only difference between those 3 budgets will be staff salaries. And I have a sheet that I'm going to hand out once we go through the budget, because that, again, that should be a kind of a guiding point for you all to make your decisions on 3%, 4%, 5%. Nothing else will change in the budget. That makes sense? Okay. So the first page is a summary, and that just shows the revenue and the expenditures and our balanced budget. And I have always removed the one-time capital just so you can more easily compare actual budgets from year to year. The capital would be included in the budget, but it's pretty highly variable. Some years it may be very little, and obviously during the remodel of this building, it was considerable. So the one point I want to make, well, 2 points on the summary, is we pulled out a category of trustee and benefits. It used to be primarily included in operating, and that money comes to Central District Health and then goes out to our communities, like the Valley County Opioid Response Project would be an example. It's part of our budget, but a lot of that money gets essentially subcontracted, subgranted out to the community. So we're just displaying that differently for the first time because it's become such a significant portion of our budget. Second point is you'll see the total expenditures, total revenue is up considerably, and it is up considerably because we are generating more revenue. But there is one portion of that I just want to call out because it's really significant and it may or may not happen. And that is we submitted a request to Ada County for the ARPA funds that they received, American Rescue Plan Act, and the amount of, it's over a couple year period, but for this budget year, it's about $2.5 million. So we're still waiting. They're reviewing our proposal now. They first did county departments. Now they're reviewing our proposal, and it's everything from substance abuse prevention to enhancing our home visitation program. So if we get all of it, this budget's accurate. If we get something between all of what we requested and nothing, it'll be reduced accordingly. But we can't do that at this time because we don't know what their decision has been. And by the way, I reached out to the other counties and they didn't respond as far as contributing money from their ARPA allocation to Central District Health. So this is specific to Ada County. That's the summary.
Can I ask a question about?
Sure.
Madam Chair? about the one-time capital. It seems to have doubled every year in the last 3 years. Can you explain that? And what is the trend for the following years?
Madam Chair.
Yes, go ahead, Russ.
Raul, so the one-time capital expenditures will, you're right, there's a trend. I'll go through the one-time capital expenditures in a little more detail further into the budget.
Yeah.
But it is, like for this building, for example, we have some pretty significant cement issues with sidewalks starting to erode. We have, little heat pumps that have to be replaced. There's a lot of cost. Now, we also have a roof that's over 30 years old, the shingles, so those are going to need to be replaced. And based on our costs at our McCall office, it's going to be substantial. So that may appear in next year's budget if we decide to move forward with that as shingles start to peel as they do in time. So there's not a particular, it appears to be a pattern, but I would say there's no pattern. It's not like, well, we're just going to keep increasing, doubling every 2 years or whatever. It's just based on what the needs are, including vehicle replacement. That's in that as well. And we replace vehicles when they get over 100,000 miles is our goal. So hope that answers your question. It's detailed in the budget.
Okay.
Madam Chair.
Yes, go ahead, Al.
Russ, I'm a little concerned about, you've already gone ahead and budgeted the 2-some million from Ada County in ARPA funds into this budget, but you're not sure you're gonna get it. You're feeling confident doing that?
I'm feeling confident that if we don't get it or we get something less, we'll take it out of the budget. A lot of that is in the T&B I just talked about. So basically, we won't be sub-granting those funds out. We won't be hiring staff. So I should have prefaced this with, this is our budget plan. By the time our counties, you approve it today, and on May 20th, it's probably going to change a bit. And by the time it actually goes into effect on July 1, it'll probably change more because of the funding streams we get. That's a big one. And then we always do a budget revision. We used to meet in February. This past year, we met in January. So that's when we'll do a budget revision and we'll make the adjustments according to what changed.
Do you know, did Ada County get more than 10 million in ARPA funds, or they only got 2.5?
No, they got like 94 million.
See, and that's the issue that we're all dealing with in counties is anything under 10 million, you could pretty much spend it wherever you want. So that's why probably the other 3 counties are saying, no, we're going to keep that because we need that for infrastructure. But where did the 2.5 from Ada County come
If I were
from?
Mike Boyle, I would just yell property tax relief right now. You were feeling it, you know it.
Where did that number come? They gave that to you, or is that what you guys requested?
It's what we requested. And we requested more than that because it's over, I think, about a 3-year period. There's rules around it. You have to have it allocated by a certain date. You have opportunities to spend it up to 1 or 2 years beyond that. So our request to Ada County all align with the direction of how that money should be used. Basically, families impacted by COVID, for example.
Madam Chair, another question.
Yes,
Did
go
you
ahead.
guys put anything in here for opioid funding that's coming? More, I see where Purdue Pharma just settled and there's gonna be more funds coming. Is that in this budget as well?
Yes.
Where would that be? Is that under revenues or is that?
So, yeah, and I will go over all that because we're going through the section. So, but I can hunt for it now, or I can go through.
No,
it and it'll
as
show
long
up.
as it's in here somewhere, that's my concern. I think that's gonna be a huge fund.
Is that? I'm sure.
Yes, go ahead.
Question, but that goes to the state, right? And then it's allocated from the state, or does it go directly to the health department?
It will come directly to us. We'll get
On the opioid settlement.
right.
Okay.
And I was going to talk about it a little bit later, but since you asked, it is, as you noted, in its final stages, and it's 253,000.
So
I think it's I know it's in here, but we'll get 200, and as you know, that's the first check, and there's more coming, there's more lawsuits in the queue, and the allocation date, approximate date, was April 2nd. So that date has obviously passed.
So you haven't got any money yet?
Not yet.
Yeah.
We're supposed to get it any day.
Madam Chair, may I add one more thing as
Yes,
well?
Laura, go ahead.
Thank you. For any of those major funding streams, I just want to point out that they are represented in both revenues and expenditures, because as we get the funds in from them, we're spending them on both personnel or spread across personnel, operating and trustee benefits. So for example, if we are taking the 2.5 million out for ARPA fundings, it would come out of both expenditures and revenues and put the budget at about 15 million instead of the 17.5. So it is represented in both areas. That's how it balances, and to take it out still leaves a balance.
It's not going to be made up by counties. So if we
Right.
don't get the money, we're not spending the money.
Just removing it from both areas, yeah.
Right.
But you have, excuse me, Madam Chair, you have to have it as a line item to be able to spend it. You have to have it in your budget when you get it. If you don't have a line item to spend it, you can't spend it.
Right.
So that's, I see what you're doing now. Okay.
And again, the budget will probably, not maybe exactly, but like the day after the counties approve it, this budget is going to be, it's going to change. It changes throughout the year, but the revenue and expenditures just continually get adjusted based on incoming revenue.
Mhm.
And we don't spend the money we don't have. Or ARPA, the reason I pointed out, it's a significant amount of money. That process started last fall, but again, we were second or third in line because the county was using the money just like Valley County did for the county and the county departments, and now they're making it available to others. And like I said, it's significant, $94 million for Ada County. Okay, so page 2. And this is something I really, obviously pay attention to the entire budget, but this is kind of that key component as far as what we're asking for from the counties. And if you look at the box, you'll see total county funding. So this is from fiscal year 22. And there's an additional line there that shows the state appropriation from last year, $1,767,700. Because of House Bill 316, that amount, which is basically 8 months of fiscal year 22 budget, is now going to be the responsibility of the county. So it was phased in. Our current year that we're in right now includes the counties covering 4/12, March through the end of June, of the public health district budget as required by law. So this is the final shift, the remaining balance of what the state, general state aid coming to the public health districts, shifting to the counties. And then as you move to the right, you see how that gets distributed among our 4 counties. So, and that's all in law. It's based on 30% market value, 70% population. And to Rel's comment earlier, you'll see on the next page, some pretty shocking numbers. I think they are shocking, surprising, not really, because we see it. So if you approve, so just to be crystal clear, you'll see up normally in the top of that box, you'll see that dollar amount, and it would say a 3% increase over FY22. And right now it says 59.5%. That's because of the state share shifted to the counties. But if you look at that, the FY22 county funding plus the state appropriation, and you multiply that by 1.04, this is the 4% budget, it equals the $5,245,936. Does that make sense? And if you don't approve the 4%, it's 3%, that'll get adjusted accordingly. And it'll get taken out of staff salaries increases for next year. up or down?
Madam Chair, I think it's pretty easy to take the old budget from 22 times 3%, and that gives you your addition to that. And I think it's, as far as the county, my county perspective, this is still the 197,000. It's going to save us a ton of money on our indigent costs, because right now we're living for about 240,000. So that allows us to keep roughly 45,000 to use for other indigent costs, which we're still going to incur, which is cremations, indigent burials, undocumented rent, phone. I mean, but there's a lot of different things that people are asking for all the time. So to me, it's still a great deal in the long term. Yeah.
Good.
At 4%.
Oh, you said last time, I think cremation's running your county 1850, right? And what
Um,
does burial cost them?
The last time we did a cremation, I think it was 1675. And we do probably 4 or 5 a month. But we do pay a lot of rent. They used to be covered under YCAP. And that program has all changed to YCAP, so they don't cover a lot of that. So we get petition to pay a lot of folks rent, back rent, that kind of stuff. So, and we're still dealing with indigent costs pre-March 31st. Stuff that happened between March when the 319 kicked in and beginning of the year. We still got, I don't know how many more that are still coming in and we've got to pay yet. So as soon as that clears the end of this month, then no more. I mean, we're done with that, but I think long-term overall, I think it's going to be a great benefit to both of us. This is going to scare some of the counties because especially the newly elected folks, but they're not going to take over until January. So it's the old folks going to be setting this budget in October. Hopefully everybody will understand this, that your indigent's going away, but you have to come in under and 735, the bill that just passed tells us that we can't have an indigent levy anymore. It's gone off the books. So we have to move that over to a preventative health levy and build that into our budget. And there's a lot of line item stuff that we have to keep track of, but I think it can be done.
Okay. Thank you. Page 3 is the numbers that I mentioned are substantial. So if you look at the change in market values, that's at the bottom of the page. Ada County increased by 26% or $15 billion. And the population grew by almost 25,000 people. So just overall, our district has grown by 5% in population, and the market values have increased by 25%. And it wasn't specific to one county. You can see the growth is occurring in all 4 of our counties. We know it's happening statewide as well. So back to that allocation, that formula is an Idaho code. It's not something that it really is negotiable. There's some desire each year by certain counties to want to, look at one's alternatives, but you'll have to work with the legislature if the counties want to change that. And that data comes from on the page we just went over from the Idaho State Tax Commission and then the U.S. Census Bureau. And those are estimates until every 10 years when they update the census. So, okay.
Madam Chair, before you move on, I just want to point out to everybody the importance of these numbers because back in 2008 in Valley County, our value was about what it is now, 5.3 billion. When Tamarack crashed and we lost that value, went down to 3.2 billion. And it's been a slow crawl back. So that would affect this formula if the economy tanks.
Right.
So keep that in the back of your head.
Yes, absolutely.
Page 4, personnel cost. The budget proposal, again at 4%, is a 3% cost of living and a 2% average merit increase. So the merit increase, and I'm going to give you the page that shows exactly how this plays out for Central District Health staff based on how you vote on 3%, 4%, 5%. But basically, with the 4% budget, merit's going to be $360,000 per salary, $80,000 for benefits, and a lot of the increases you can see. There's a lot of staff we hired. We actually receive ARPA funds like through the through Department of Health and Welfare. We have the opioid settlement that's coming in any day now, 253,000 to start. Nurse Family Partnership, which we're getting off the ground. Still working with Medicaid on some adjustments that we feel need to be made for paying us to provide services to Medicaid families. That should help certainly on the revenue side. And then we have the COVID epidemiology and immunization staff. The money's still significant in that area. Operating cost.
Russ?
Yes.
New permanent staff for COVID. I thought we were gonna shrink back at some point, but they're permanent.
So, Laurel.
Yes, I can answer that if.
Go ahead.
So that includes the removal of the 13 temporary COVID positions. The permanent COVID staff are for the COVID epidemiology program and the immunization response. So those are as long as we have the grant funding to continue those. We know that we have it into the next few fiscal years. We're considering them permanent positions. We're not hiring temp staff. We're working with temp agencies to fill those positions any longer. So they're positions that have been added to our organizational charts. But when that funding goes away, in however many years it is, 2 to 5 to 7, or if it becomes a permanent part of the work that we do as a health district, they can stay permanent. But that's the representation there. So some of those positions are considered permanent, but we have removed the temporary positions that we had for the COVID response as well. So it balances out.
And to add to that, once we fully implemented House Bill 316, developed our own personnel manual that the board approved working at CDH at a previous meeting, we're moving away from using the term temp staff because temp staff come from temp agencies. All of our staff are subject to funding and all of our employees are now at will. So if back to the point, if we don't have the money, then we have to make adjustments. So temp staff, we refer to people we hire from temporary staffing agencies. Permanent's probably a term that's not necessarily accurate because it's permanent as long as we have the money.
Yeah, Madam Chair.
Yes, go
I
ahead,
just
Amy.
want to make a comment that we need to make sure we track that so that it doesn't end up supplanted with county funds. So
Got
that
it.
you haven't added personnel to deal with COVID, whatever, and then you start supplanting it with county money.
Got it. And we do. We track it.
Okay.
Madam Chair, just a quick question.
Yeah, go ahead now.
Russ, are you feeling like with this 788,000 in increase, this is going to get most of your employees at a level that are pretty confident, or are we looking at coming back again next year and doing this again?
Doing
Another 4% or another 3%? I mean, I know you were going to talk about salary survey, and I think you got some of that done.
We did.
Where are we on that scale? Are we still 10% too low or 15% too low, or?
We had Robert presented to the board, there were 28 positions, 28 people in 7 positions. And we are working with him to make sure, in fact, because it's basically that was matched up to the healthcare sector in the Boise metro area with employees between 100 and 200. But when you're matching employees outside of government, like a staff epidemiologist, how do you make sure that that aligns with somebody working in the healthcare setting? I mean, we are a healthcare business, so some of the positions were matched early on among all of our staff. The ones that came out that show that they're low, that we need to make the adjustments for, were Laurel and Gary and I are revisiting that with Robert just to make sure they're a correct match. And I don't quite understand how all of this works, but if you match it to an employee that's not an exact match, we can pick other jobs in the private sector and weight them, and through his formula process will come out with, we would expect, a more accurate range if it's not already accurate. So we haven't done that yet. I guess since we're talking about it, just to give you some perspective, So since we met on March 25th, we've had 3 more staff leave the agency and 3 more give notice. So that's 6 more staff. That's less than a month ago. I know at least one of them is going to St. Luke's, for example. So we're losing staff. Raul, you asked about maybe what other health districts are doing. So most of us are in the same phase we're in right now. But District 7, Eastern Idaho Public Health District, has board approval, and they've already implemented salary increases ranging from 7.7% to 15.42%, and that's based out Idaho Falls. The state of Idaho, approved by the legislature, I shared that with you the last time, but I want to make sure I say it again, is there's a 3% cost of living increase and up to $1.25 per hour merit-based increase. So an employee who's making $15 an hour working for DEQ or Fish and Game, if they will get the cost of living increase, and if they also get the $1.25 increase, because they have the highest level of performance, they'll get an 11.3% increase. So I think what I'm asking for is way on the conservative side. We don't know what's going to happen economically, right, over the next couple of years. We have gone through periods of time where we gave 0% pay increases back to the time that you mentioned after the 2008 housing recession happened. So to ask if we're going to come back again next year and ask for pay increases, likely we would, unless things change dramatically, heading in the wrong direction. So where those 28 positions were, they're obviously going to be included in whatever you all approve for a cost of living plus the merit based on the budget. So that'll close that gap a little bit. But as Robert mentioned, and as you all know, we can close the gap now based on the data we used from last year. That's going to shift. It's constantly shifting up because of dramatic inflation that we're experiencing.
Madam Chair,
Yes, go ahead, Al.
the reason why I asked that question is because if you send a signal to your employees that you're going to get a 7% this year and a 6%, this is what the goal is. It may not happen, but our goal is to next year you get bumped. In the counties. We couldn't afford the 15% increase. So we came back, so we're going to give everybody a 6% for at least 3 years to get everybody up that level. They'll rethink about leaving. In other words, they can see some light at the end of the tunnel. I think that's kind of important for us to relay that as a board that, you know, we're very serious about salaries. We want to take care of our people. That's
right.
It's easier to pay more than it is to train new.
No doubt about it. And we have another plan that I'll talk to you about on May 20th as far as a retention strategy. And I'll give you some more detail in May. And then that'd be something that you would be asked to approve at the August board meeting. So it's something that I know is used in the private sector to try to retain staff. It's not just salary, but future opportunities that if you stay, you get.
Madam Chair, are you guys, like, if you take on a new employee, new whatever, and they come in and they've got 0 years experience or they got 15 years, can they negotiate that salary with you and HR? Is that a possibility? You guys have been doing that?
Yes. So So our salary ranges, which is the state salary ranges, that was a person of the Robert Grifford report, was, are we in alignment or are we not? That's statewide. They do their assessments and use Korn Ferry, and we did it specific to our community, just like Valley County did and Elmore County did a couple of years ago. And generally they do align. So then when I say generally, there are some positions that are too low, at least with the first round of matching. We hire so the salary range is 70% of midpoint or policy up to 130%. We haven't brought anyone in below 80% of policy for a long time. And those are the entry level positions. If you come to us with 20 years of experience as a nurse, for example, you're going to be paid well above 80% of policy based on what you bring to the job. So we don't have a set rate for everyone. Every position's evaluated. You always have the salary compression issues, right? If you have other people in that same role that they've been here for 5 years and you bring somebody fresh from the outside that has less experience, you're not going to pay them more, right? You pay them less. So we have a thorough review every time we offer a job.
Yes, go ahead, Megan. A question. So of the employees that you've lost or given notice, are they department specific or are they spread across the board? And are they fairly new hires or what is the demographic look like?
It's across the board. They are often under 5 years. And I would think that may tie with the idea of, pensions that we offer that a lot of employers don't offer. They're not our higher level positions. So backing up in time, we always had turn in the lower pay grade positions, medical assistants, customer service representatives, clinical assistants. What we have now is we have the same or higher levels there, but it's moved into our professional level positions. Environmental health specialist, for example, epidemiologist, not so much the manager level right at this time. Did I answer all your questions?
I think so. I'm just trying to figure out if some of these people are leaving because of pay levels or if they were actually matched up, or is that the cure or is it something else?
So we do exit interviews on all employees who are given the opportunity, and most take advantage of that opportunity. And most employees that are leaving are getting paid more. Now, they don't necessarily say that's the primary reason they're leaving, but they are getting paid more for the positions they're leaving us to go to.
I guess that's not what I mean. Madam Chair, my question is, you're sitting there and if you're saying you want to match to some degree what the public sector or the private sector is paying folks. I mean, yeah, everybody's going to leave for more money. That's going to be a common answer. But is it because their rate of pay when you did your match is actually that much lower than the private sector, or have you gone to look at that?
So our rate of pay, the pay grades that we're using and the pay ranges are mostly appropriate. But our staff, like when you look at where they're paid within the range, tend to be often on the lower end of the range unless you've been here for 20 plus years. So what's happening is other employers in our community are paying them more. So even if they're within the same ranges, so our ranges generally align, they're paying them more within that range than what we have traditionally paid. And that hasn't always been the case. Like I said, we've had historically, it was more the entry level staff who would leave to make literally a quarter more an hour or 50 cents more an hour. Well, they're making a lot more than that now. They're making dollars per hour more to leave us and go work someplace else.
Right. Well, and my question is throwing more money at it. Is that a solution? Because if the pay levels are already matching up with the private sector and they're just going to be driven to spend more per employee, I just question whether the raises will increase retention or not.
I think it's a fair question to ask. I really do. And we do, which we will do, an annual climate survey, culture survey, and historically, I guess I would say, rated quite well. Staff like working here. They believe in the mission. They like the culture. They're not leaving because I don't think anybody, I can't remember because I see them all, the exit interviews. People don't leave because I just don't buy into the mission. I don't like public service. I don't like my boss. We've done a lot to try to create a good environment. I think the remodel helped with that, with our nice break room. We try to do employee lunches periodically. We try to do things within reason here to make it a good work environment. and make sure that employees know that they're appreciated. But at the end of the day, as long as we have a wage war going on among all, I'm sure you see it in your business too, I assume, just if people.
No, the federal government tells us what we get to
Right.
pay. There's not so much a war as a gun to our head,
Okay.
so.
So that was not a good example. But bottom line is, it has been very difficult, but it's not, people don't just go work for another business and then they stay there. They're moving all over right now. It's constant shifting. I want to go there because they'll let me work from home 5 days a week, and you only let me work from home 2 days a week. Okay, you have to be here to serve clients. You know what I mean? So it's going to settle out. I mean, I believe that it's just not settling out right now, and I think we're just doing the best we can. But again, what I'm asking for, I might as well hand this out now while we're talking about it. Here you go. Here's a batch.
Can I ask a question, Madam Chair?
Yes, go ahead, go.
Page 5, your facility projects, it says FY23 Boise site development, 205,000. What is that?
Yeah, so that I'm going to have Laurel tell you the specifics, but a lot of what that work entails is things like landscaping, repaving parking lots, fixing broken sidewalks. But if you wanted,
Yes.
you probably have a list of them.
Madam Chair, yeah.
Yeah, go ahead.
Sure.
So the site development costs for Boise include a bathroom remodel in the building. That's to the 2 bathrooms in this hallway and the 2 staff bathrooms. They include landscaping in the front of the building, trees in the back of the building. We have a couple more removals to do. We actually had some issues with squirrels that bit through some of our wiring in our vehicles and had to have repairs on those. So we'd like to continue to remove a couple of the trees in the back there. And then the sidewalk project. So it's, yeah, I know. So the site development includes anything that's a construction or remodel related cost overall. And then the building improvements are things that are updates. That's where you see things like HVAC, heat pumps, generators. We've got in that category emergency lightings in the exam rooms. We had a power outage this year that caused the exam rooms to go completely dark. It didn't have power and caused some fear for patients, as you can imagine. So that's where you see the upgrades and replacements. Those are considered optional, whereas the site developments, we consider things crucial to maintain our business. But there's definitely some crossover between the two and what we consider essential.
Madam Chair,
Yes, go ahead, Megan.
didn't we just do a remodel? Why do bathrooms need to be remodeled after the big remodel?
Madam Chair.
Oh,
Yeah, go ahead.
We didn't do the bathrooms. They weren't included in the remodel.
Madam Chair, I guess I have a comment. I wasn't sure when the appropriate time was, but I did talk to one of the commissioners in Ada County, and they will be very vehemently opposed to any kind of increase, especially when the majority of the budget comes from their one county. They don't have a problem with the regular 3% increase, but we keep talking about 4 and 5%. I know that I'm not going to be able to agree to that after talking to one of the commissioners, and I think they will be fighting very hard to, if this board actually votes for that increase, they're going to fight very hard to make sure that doesn't happen. So I think we need to have all the cards on the table and maybe look. I'm not opposed to increasing the salaries of the employees. I think you do a good job, and they do a great job for the citizens of our community. But the reality is that I think the biggest funder of this health district is going to be vehemently opposed to anything above a 3% increase. And I think we just need to be realistic about that. I wasn't sure when the right time to approach that, but I just wanted to make sure that we have that on the table.
Sure.
Yeah.
Sure.
Yes, Commissioner Stern, go ahead.
So the other thing I'd like to contribute to that, the salary increase is we all know there's going to be at some point a rock bottom to McDonald's fighting each other for $16 an hour. And when that happens, those folks can go back to $7 an hour. We can't. And there's an opportunity, even though we have a steady salary increase, we have a steady salary period for our employees. We have to remember that at some point, all of these private agencies that are stealing folks, poaching folks, whatever you want to call it, from government agencies for strictly more pay, at some point, there will be a decrease in that ability to pay those folks whenever the workforce decides to do whatever it's going to do, because apparently people can afford to stay home nowadays. But when they go back to work and there's people knocking on the door, you're not going to get $19 an hour for pushing carts at Albertsons anymore. And when that happens, those folks can reset and we can't. And so I think that that's a super important thing to look at, is if we did a 5% raise or a 7% raise or whatever, we're stuck with that. We have to go 3% above that next fiscal year, or nothing, or whatever the case may be. But we can only go up from that. We can never go back. Government agencies don't get the opportunity to say, hey, we're going to decrease your pay, deal with it, because then we know what comes after that. Whereas because we're an at-will state, all these other companies can terminate their employees at will that they're hiring right now that maybe aren't the employees they really want, but they're paying them 16, 17 bucks an hour, 20 bucks an hour, whatever. They can terminate those employees and hire a better employee for 8 bucks an hour whenever the economy changes. And I think we can all agree that the economy is going to change at some point. This is not sustainable. And so I think we have to look at that too, not just what we're going to do this year. I think we have to accept that we're going to have some turnover because of people being poached, and just look at that from a realistic standpoint and do our best to keep in line with what we've normally done to try to push forward, because we know, or at least I feel like we know based on evidence in the past, right? History repeats itself. Eventually, we're going to be in a better position. We just have to kind of whittle our way through this time, rather than trying to keep up with the private sector or even compete, which we know we can't because we're being funded by the private sector, not the other way around. And so I think we're better off that way. That's just kind of my 2 cents.
Madam Chair.
Yes, go ahead, Russ.
So while we're on the subject, and since what's before you, appreciate Raul's comments as well. We've certainly had years where not all the counties have agreed to the budget, but it's simple majority. And by law, anybody who would oppose it, in our case, if it were 1 county out of the 4, they still have to pay. So, and to your point, Commissioner Sturm, I guess, and I appreciate you bringing that up. So what I shared with you earlier is what the state's doing. Like, low end is of their pay increases, or again, it depends on their hourly wage, is 11%. Eastern Idaho Public Health District just gave their employees on the very lowest end, achieved performers, a 7.7% increase. So if you'll look at what I'm proposing, and I totally get what you're saying, is if a 5% budget was approved, the very highest performer at Central District Health would get a 5.75% increase. So those are the best performers. And I get it. That's a pretty significant increase, but it's nowhere near what the state of Idaho is doing. That's also a government agency or one of our peer public health districts. So just for perspective, and what we've done in the past, just so you're aware too, is you're right. You don't decrease people's salaries, but you're always going to have turnover, even at the lowest turnover rates. You have retirements, you have people leaving, and we're going to stay within our salary ranges. We're not moving our salary ranges 10%. We're still going to bring entry-level people in at 80% of policy. So you're right. I mean, deflation would have pretty drastic consequences to our entire economy, right, in the United States. So, you would expect you're not going to have 8% inflation, but it probably won't be negative, or if it was, it wouldn't be for long. So I guess the point is, with whether we do a 3%, 4%, or 5%, you can see how it works out. Somebody who's doing their job and doing it well with a 3% increase will get 3% increase from our counties will get a 3% increase in salaries. My opinion, that's not even remotely competitive to what we're dealing with right now. But again, it's up to the board. You guys get to vote on the budget today. Hopefully you provide support with the counties that you represent as I go out and speak to them. And ultimately it'll be their decision to make on May 20th. So I'd like to just finish the budget up real quick and you guys can look at this and ask me questions and then vote on it.
Well, Madam Chair, I just have a comment. I think that it's not so much just directly salary related. I think what we're looking at is just this glut of money in general that's flowing through public health and various spectrums. And my concern, I think, dovetails more on what Commissioner Sturm says of, I'm concerned about ongoing. And just every time you ask for more, it never backs up. And that's my concern in going past the 3% increase, which is been traditionally what we've asked for.
Madam Chair.
Yes, go ahead, Rose.
So I guess how I look at it is there's one-time cost
Right.
that we've talked about. There's shorter term cost like COVID response money that doesn't cost, it does cost Idahoans because it's federal government money that we either take and we do the work, just like ARPA funds at the counties. You guys could have said, no, we're not taking any federal money. We take the money and you use it. We don't take it. I can guarantee you it's not going back in anybody's pockets from the federal level if we don't take it here, because it's coming to the state. They'll reallocate it out to somebody else. But the point about salaries is if you say, well, 3% increase per year and associate that with, well, if you continue to ask that for that every year, then your budget's going to increase by 3%. Well, if you don't, how do you keep up with houses that are $600,000 average price, or fuel that's $5 a gallon, or groceries? All that impacts people's budgets. So if we give them a 3% this year, our staff, their purchasing power with that same dollar they made last year is far less.
Not sure. Yes, go ahead. Yeah, I'm familiar with the
Right.
theory. It's not that I'm arguing that that's a problem. What I'm saying is that this is creep. And if you're going past the 3%, which has been the traditional ask, and I wasn't here for the last meeting, so I don't know what the discussion was. But I feel uncomfortable asking past that 3%. It's not necessarily because it's salary related. It's just part of the deal when we turned everything over to the counties was to kind of cap costs as well. And so this to me smacks of now we have permission to ask for even more because the funding stream has changed. And I have difficulty with that.
I'm sure.
Yes.
So I hear what you're saying. I just look back in the history of time that I've been here, which is almost 17 years. We haven't always asked for 3%.
But we never asked for more.
We asked for 0% some years. So we're not just rolling ahead 3% a year. It doesn't matter what the economy's doing. The reason I am asking for a 4% is because of what has happened in our economy, cost of living, and what we're experiencing with turnover right now, unprecedented. And there may be other reasons for it. I get it, but certainly salary is one of those things that we're losing ground. People are leaving and they're getting paid more. And I guess I do see this as an opportunity to ask for, I understand as it's shifting over to the counties, but the county revenue, market values have gone up 25%. So, and our population, that's who we serve, has grown by 5%. So we can hold the line on the budget and ask for 3% or less if that's what the board decides. But the consequence to that is increased turnover, the cost of turnover, and the inability eventually to recruit. So
Yes, Jean.
In talking with the commissioners, though, it sounded like they were asking in their budget for their employees 2% plus 2%, which is the 4% going forward, and that's still less than what the state is looking at 5%. And Social Security at 5.9%. So it's like, we look at the whole picture and the cost of turnover and what it does not only to dollars, but what it does to wanting to perform and wanting to serve the people that we are serving. The energy goes down because if you don't think I'm worth it, then why am I going to put the energy into it? And so it's not just dollars, but we're looking at a different population as well that they need to buy into what it is that we're standing for. And we have to show them that we believe in them. I think.
My turn.
Yes, your turn now.
I can tell you, when you've been through it, when the economy's crashing and your values are going down, not only do you cut salaries, but you cut programs. There's all of a sudden things that we're just not going to offer anymore because we can't afford to do it. There is a way to move money, salaries down if you get into that point. But like Jane said, the really important issue is what kind of a message are we sending to our employees? We don't value enough to give you a 3% raise. And I'm not trying to lay a guilt trip on anybody here, but it's in my first 2 years as commissioner, we have 165 work staff. We lost 105 people in 2 years. And we would hire people, send them to training because appraisers need to be trained, DMV, all those positions needs training, sheriff's deputies, which was huge. And within 3 months, they would get a job somewhere else for more money. And it was pretty much always the money. I think whether we settle on a 3% or a 5% or 4%, that's kind of going to be what kind of feedback you get from the counties. So when you present this budget here next month and to the county, say, hey, the reason why I'm asking for this is because we're way behind on the salaries. We're losing folks. The counties have been through that in the past and they understand that concept. The thing that I don't think our economy is going to tank because the interest rates haven't really moved that much. Inflation is going to hurt us, but I think with the growth and the people coming in here, this is just going to keep going and going and going. And I don't want to be too conservative and lose a bunch of great staff here because we were too afraid to pay them more.
Madam Chair.
Yes, Ralph.
I just want to make it clear that 3%, 4%, or 5%, we're actually sending a message that we value our employees because the difference is they're all going to get at least a 3% COLA. And if they're solid or exemplary, they're going to get at least a 1% or 2% on top of that. So at a minimum, the solid people are going to get what that 4% that Ada County is giving their employees. So I don't want to send any message to the employees of the health district that they're not valued because at the lowest, it's still at least a 3 to 5% increase. So I hope we're not sending that message. I think they're, whatever we choose here, it's going to be a message that we value what we're doing and we want them to see a salary increase. So I don't want to send a mixed message. I think we're just saying how much can we afford, not do we value them. And those are two separate questions.
Another, I guess, point, what we're talking about is $50,000 between the 4 counties, between the 3 levels. So 3%, 4%, 5% from the counties. And I get it, it's taxpayer money, property taxes. It's $50,000 is what the difference in those 3 steps are, just so you know what you're voting on. And again, the salary plan that we put together, I had originally proposed 4% at the March 25th meeting. You guys asked for 2 additional budgets. You have that in front of you. You see what the impact is on salaries. And I just wanted to make it clear it's $50,000 shared among the 4 counties.
Madam Chair.
Yes.
I do have a question. Can you meet your salary goals by not increasing the budget? I mean, but decreasing some of the expenses that you have because everything's going up. So maybe you just kind of move your numbers around with the 3%. It's just a suggestion. You're sort of relying on one revenue stream to be the one that gets you to your goal. There's multiple revenue streams. And that's what I have to do with my own personal budget. That's what I have to do with my business budget, is when I'm not getting revenue streams from one, I have to go somewhere else.
Right.
So,
Madam Chair.
Yes, go ahead, Chris.
So, yeah, your point's well taken, that there are certain revenue streams that we don't really have much control over, which is about 40% of our budget and all the federal money coming in. So those employees, we do make adjustments, and we will make adjustments to meet our salary goals. We're in a unique time where we have more revenue coming in than we've ever had, but it's always very prescriptive.
Yeah.
When we sign contracts, we agree to do this for this amount of money. You don't have flexibility. You either do it or you don't get the money, or you don't do it to the full extent that's required, and then you reduce your budgets. And that's primarily coming through agencies like Department of Health and Welfare. So, in fact, I think just to add a little bit to what Commissioner Hasbrook talked about, back during the recession years, we eliminated 2 entire programs. We used to do adult travel vaccines, gone. We used to do senior nutrition programs, home delivery, and those programs were completely eliminated so we could balance our budget, because we lost $750,000 from the state of Idaho, from the legislature. So there are ways to make adjustments, I guess.
Madam Chair,
Yes, go ahead.
I'm just looking at the capital outlay budget again. We just bought 3 brand new cars, and we're saying that we don't drive them past 100,000 miles. Most people driving way past 100. Can we go to 150? And that gives us an additional 30,000. We're spending money on site development. I'm just saying that there are ways to just think, if you do want to achieve your goal, it's not only through the 4 or 5%. We can get the 3%, which is the traditional amount, and then look for other ways to kind of meet our goals. And that's the last I would say. Thank you.
Yeah.
Madam Chair, I think Rel has a very good point. If you look at the budget this morning, we figured out that there's about $3 million in cash balance. There we can, I'm assuming if we don't go 4% or 5%, we get a 3%. We'll probably use some of that to make up that difference, I think, to get our employees to where they need to be so they'll quit walking out the door. That's really the main goal. The difference between the 3% and 5% is about $120,000. And I'm assuming there's probably some positions here that make that individual people. So it's a very small percentage of our budget, total budget. And like I said, the counties, most of the counties, if you go to Ada County, you're going to have a lot of money left over in your indigent fund because you're not spending that anymore. I don't know how many millions it is for Ada County. So I think those commissioners have some room to use some of that extra that's going to not be spent for this type of a raise. I think it's very appropriate. And these folks deserve it, man. They've been through 2 hard years of COVID and all the crap that we've had to deal with that. I think they deserve it.
Well, Madam Chair, one of the things that we're running into in Boise County is our indigent system has all but dropped off the planet. 99% of what, in fact, I haven't had it. I used to get an indigent case 1 or 2 a week. I haven't seen one in 4 months, 5 months. And so we have yet to discuss how we're going to, because we can't levy under the indigent anymore. We have yet to discuss how we're going to present to the people a tax for Central District Health. Essentially, that's what it boils down to. And that discussion hasn't even happened yet. So as far as even financing this, it may be something, as far as Boise County is concerned, it may be something additional that comes out of our budget that isn't levied for, that we just end up fronting the money out of the actual budget. And on top of that, we don't know what that looks like financially or what we can, what we have to spare for that. That discussion hasn't been had yet, unfortunately. So that's kind of, we wanted to see the budget first before we had that discussion to see what we were looking at, being asked of, what was being asked of the county. And so that's kind of a hard position for us, just specifically. I know, El, you said that you guys were gonna change the levy, the name of the levy, and levy it differently and use, the same funding source. But we haven't got that far yet because we have not had a need for that money, period, in any way, shape, or form. Because Medicaid, just the nature of our county demographics, the indigent fund, when that went away, I mean, that all but eliminated our indigent fund. We didn't need it. We have literally, like I said, no indigent whatsoever, other than burials, which you pay $1,650, we pay $700. So, and we won't pay for a burial, we only pay for cremations. So ours is less than half of what Valley County's is for that. And so we use that out of our discretionary fund for indigent. And so that's a real small fund, obviously. There's $5,000 in there or something. So at the end of the day, that's kind of what I have to look at for my county is where are we going, where's this funding source going to come from? Because we're not going to levy that. And when we go to the public and say, hey, we need to levy to pay Central District Health, I mean, to be quite frank, my county's already mad at us. And then I'm going to ask them for money to pay for a service that they don't even want to see. Quite frankly, most of them could care less if Central District Health even existed. And so now I'm asking them for money specifically to pay this department. And that's kind of just an issue we run into, right? Is having that conversation, figuring out what is reasonable and what is acceptable. And then of course, everybody's going to get, I think the government's going to pay the price all the way around in the public, versus the public sector versus the private sector, just because of revenue streams, right? If I'm a private business, I can afford to pay you $100,000 a year to do a $25,000 a year job, as long as I got people lined up around the block for my services. But when I have a taxpayer paying for someone's wages who maybe doesn't want to pay me to do my job or anybody else to do their job, that's kind of now we have a different dynamic. It makes it very difficult. At that point, you kind of have to love what you do, or it is what it is. And that's unfortunate. I know that's unfortunate. And that's not to say that anybody here isn't doing an amazing job and put up with an incredibly large amount of garbage for the last 2 years, which we all have, and we're all aware of. But I think at some point, the funding is the bigger issue. When you have bigger counties, you have bigger coffers. When you have smaller counties and less residents, you have smaller coffers. And it's kind of, especially when there's changes with different House bills at the legislature level and at the state level, you also have folks that are trying to figure out, me personally, I've never had to adjust a budget before for a new levy stream. So you've got 3 commissioners in my county that have never had to do that. And so we're trying to figure out legally, what can we do to levy for this, levy for this system. And there's just a lot that goes into it. And I think that's the concern, and maybe a little bit of fear in there as well, is, how do I approach my citizens and say, I know you're already being taxed, but I want to take more of your money for a system that you as a whole and may not even believe in or agree with. And so that's kind of the hard part, for us coming in front of them and those folks. Because when I leave here, I have to go to those folks and say, hey, I want you to pay 50, 100, whatever $1,000 of your tax money to go towards this process instead of this other process that we were already levying. So just a little bit of, background there, having to deal with that.
Madam Chair, I think Brian makes a very good point. It's the legislature's fault.
Madam Chair.
It is not to blame the legislature.
You guys asked for this. I mean, in defense of the legislature, this was what was requested by the boards of health of the state of Idaho. They wanted it. The Association of Counties wanted the counties to be responsible for this. And this is what it is. Knowing that this problem was coming, this was what was asked for.
Actually, we didn't
And
ask for it. That's not necessarily a
that-
true statement.
it is 100% true if you
Yeah.
go back
Oh,
to
I'm like-
listen to the hearings. Also, the indigent fund, with regard to that, isn't necessarily set up to pay for Central District Health. A lot of what the indigent fund was paying for then got supplanted with Medicaid expansion. And that was what the deal was that we removed the indigent levy because not all of those, because of course there are the burials, cremations, what have you, but the majority of those indigent dollars were to be used for folks who had medical bills. So we're talking about different things here. So just
Right.
in defense of what was done, that
Yeah,
there-
absolutely.
I appreciate that people love to blame the legislature, but
You, I promise.
yeah, but you know, that's why I have concern about going past 3%. Is this discussion we're having right here in I was not a fan of turning all of the dollars over to be fully county funded. Went along with it because that was what was requested. But I was concerned about this very problem of how much will counties want to support, and that's why I am very hesitant to go past the 3% and to ask for more than we ever have.
Well, our commissioners always look at two numbers here on the last page of Laurel's report. And they say, well, you know, look at all this money you've got, where are you asking for more? Oh, that's always the question.
Well, and my fellow commissioners always ask, why are we giving them money? Why do we give them a dime? Why is the state not paying for this service? And why are we paying for this service? And why are they telling us what to do? And so and that's just from, you know, our board meetings. I mean, it's on record many times in our board meetings that those are common questions. Why are we paying for a state agency? Why are we, you know, why are they telling us what to do? Can we just get rid of them? I literally have a very large group of people, along with some commissioners in my county, that would love nothing more than to see Central District Health just disappear completely. So trying to push a 5% or even really probably even a 3% at this point raise, other than the fact that we're all humans, right? And we understand that people got to make a living and they're doing a good job. It's not that anybody believes that nobody's doing their job. It's more along the lines of being upset about the funding stream and how that's changed, because now it's going to affect, if we have to pay $50,000 to CDH from our budget in Boise County, and it doesn't, and we don't find a way to change that levy or add a levy, right? Remove one and add another. That's two of my salaries employees. And when you talk about my lowest paid employee, that's four of them. I have employees that are making $12 an hour. So you're talking, I'm replacing 3 or 4 employees to pay Central District Health for what most of Boise County feels like they get no benefit from, other than getting the pleasure of seeing Jerry Davis when they want to get a septic or a well, which they really don't want to see him either. So, I mean, at the end of the day, if we're being completely honest, you know, if we're being completely honest with each other, most of the people in my county would love nothing more than to go, no, we don't have the money, so let's not give them a dime. And so that's what I'm gonna go home and face, right? Is that's the situation I'm in is, and then on top of that, I'm gonna argue for 5%, potentially up to 7.5% for a good, you know, for a really good employee, which I believe they're worth it. I totally believe they're worth it. But I'm going to argue for that on top of having a situation where there's a very large group of people that just don't support it. They just don't want, especially once the majority of voters find out that this revenue stream used to come not from them. And so when they figure that out, and now it's going to come from them directly as a new levy, potentially, because I don't see another way, that's really going to rub people the wrong way when they figure that out. And I think that that's something that we need to look at, is that was just a funding change that happened. It happens all the time. I mean, we're talking about getting rid of sales tax potentially. I mean, that's the money still has to come from somewhere. It doesn't just go away. It still has to come from somewhere. So unfortunately, that's the piece that I have to look at as well, is for my constituents and for, even for just people in general, right, is where does this money come from? Where does this $410,000 come from? And that comes from the counties now,
Madam Chair.
unfortunately.
Yes, I'm sorry.
No, you're fine, Rick. That's good.
So Representative Langton would have to maybe help me a little bit with this, but so right now, there already is a levy that exists, a preventive health levy that our counties are using to collect revenue for Central District Health. This is statewide, not just our district. So number one, there's a levy that exists, a new levy, the rate has to change, right? And as I understood in the negotiations in the counties, you did have options, right? You either give up revenue sharing or you're going to fund the health districts. It wasn't, we don't have to do anything. We'll just keep paying you. But you're going to choose one or the other. So then the next part of that, as I understand it, is as a taxpayer in Ada County, I was being taxed at a rate from the data that IAC shared at a much higher rate for all 4 of our counties to pay for indigent care than what you'll be taxed with an increase in the levy rate for the preventive health levy. So as I looked at it, and again, this was Seth Grigg providing the data, the counties, and you know, I know it's not quite that simple, but if you're saying to your citizens, you need to pay me for indigent and you pay me for public health, and then the state says, well, you're going to cover the state share, everybody acknowledge your indigent spend has gone way down. Way down. So if you push that over onto the preventive health levy, that amount that went way down, the difference is, as I see it, and I talked to Doug Miller, if the counties continue to tax at the exact same rate for preventive health or 3% increase, and you continue to tax at the same rate you used to tax for indigent, now that we've moved that over to public health and indigent is gone, the counties are actually going to save money.
Madam Chair. Yes, okay, again, the indigent, to tax the indigent at the same rate doesn't take into account Medicaid expansion. And so that, keep that in mind, of the indigent fund wasn't set up to pay for public health. What it was to pay for those costs that was the sales pitch. If you go back to all the Reclaim Idaho stuff, when we did the expansion, how much it was going to cost, that Medicaid expansion costs that were incurred to the county are now, the cost incurred to the county through the indigent fund for healthcare was then taken over by the Medicaid expansion. And so to say.
In fact, they claimed there was going to be a decrease in your costs, which we all knew was not true, but that was the claim, that they were going to decrease everybody's property taxes by doing Medicaid expansion.
Right, and so that was, thank you.
Yes.
That was the point of killing the indigent fund, was because presumably the vast majority of those costs were now funded through Medicaid expansion. So its relationship to public health is not what you're describing. That's not how that worked.
Madam Chair.
Yes, go ahead.
I'm not in any way suggesting that the county indigent fund should have continued and should have been the mechanism to fund public health. What I'm saying is the counties were given the option to give up revenue sharing or fund the public health districts. To the taxpayers, the way I see it, is the cost for indigent care has gone down. I know that's gone away, but the amount of money that I have to pay if you increase your levy rate to fund the health districts, which you have to do through the preventive health levy, I'm not paying medical indigent funds anymore. But the difference between what I'm going to have to pay in addition for public health compared to what I was paying for medically indigent care, public health is cheaper. Taxpayers should save money based on the reports that Seth produced.
Madam Chair, I think this that's a pretty safe, I think there was only 2 or 3 counties where it was actually gonna cost this more because they didn't have any indigent costs.
Right.
But the indigent levy is gone. You can't do it. It ended at the end of March. And I would suggest, Ryan, that you try and send somebody to the ISC training that's gonna happen at Burley, the Spring Institute, because they're gonna teach you how to budget all that and move that over line item. For
Then
example,
we'll fix that again too.
in Valley County, we levied for indigent was about 250,000, 247,000 a year. I only have to come up with, what is it? 197 for this next year's budget. So I got 655,000 left. So I'm gonna keep some of that used for indigent cremations and burials and rent and phone, and then the rest of it, I can reduce that levy down and reduce property taxes. That's how it was supposed to work, but Russ is absolutely right. It wasn't that the counties wanted to do this. It's that the public came in and voted, and they want Medicaid expansion. And the legislature came to the county and said, you can either take over this cost, or we're gonna take some of your sales tax revenue away from you. We sat down and figured out the sales tax revenue hit was gonna be way bigger than if we took over this. We didn't wanna lose that sales tax revenue. And so that's the design we came up with, and I think it's gonna work okay. You're not really raising anybody's taxes, you're just calling it a different levy, but you've still been levying for it all along. Whether or not you agree with Medicaid expansion is a whole different level.
Is this a good point to stop? And I'll make an executive decision here that we're gonna have a 15-minute break. So we will reconvene at 20 till.
Going live.
That's why we
No.
hired you.
We're good.
Okay, thank you. Okay, folks, we'll turn the budget discussion back here to our Director Duke.
Thank you, Madam Chair. So you have a budget, balanced budget that I presented to you. And I asked for a 4% increase from our counties. This board requested that I put 3 budgets together to include a 3% increase from our counties, the budget that I requested, and a 5% increase from our counties. The budget that I walked through includes the 4% increase. I provided you with the merit increases and how that gets changed based on what the counties provide. You're well aware with the shift of 316, the counties are now responsible for 40% of our budget rather than about 20% of our budget. I'm going to request your approval of the 4% budget I presented. It's up to you to make that decision whether you choose to accept 3, 4, or 5 or something different. And if you want us to build a new budget and bring it back at a different date, glad to do that. As I said, I think during the break, your job is to approve a budget that'll be presented to the counties. It's the county's responsibility to approve a budget for Central District Health by the first Monday in July. So with that, I'll stand for any questions you have. But it is an action item.
I'll just make a motion to accept a budget with a 3% increase.
I'll second.
Okay, the motion has been made and seconded to accept a 3% increase for our 2023 budget. Is there any further discussion before we call for a vote? Hearing none, I will call for a vote by county, starting with Ada County. Dr. Young.
Nay.
Okay. Raoul Labrador.
Aye.
Okay. Dr. Cole.
Aye.
Commissioner Stern, Boise County.
Aye.
Elmore County.
Aye.
Valley County.
No.
Okay, the ayes have it for the 3% increase on the budget this year. So we will proceed to the next agenda item, which is review and vote on the CDH policy for COVID-19 guidance. Russ, you want to take that discussion lead, please?
Yes, thank you, Madam Chair. So at the March 25th board meeting, there was a discussion and a decision by the board to have me put together a draft policy for your consideration, which is a guide for you all to weigh in on any guidance that Central District Health Department issues to our community relative to COVID-19 for minors. So I put together the policy. I sent that out to you all via email not long after the March 25th board meeting. Had an opportunity to review it. I had not received any feedback or suggested changes, so I'll assume this is a draft that was acceptable, at least up until today. And this is an action item. And then after you vote, if you approve it, what I'd like to hear is what specific topics you would like for CDH team to bring to you at the next board meeting, which is May 20th, because as I also noted in emails, pretty much everything we do in terms of guidance and recommendations to the community affect the broader population. Obviously, there's fewer exceptions to that if it's long-term care facilities, for example. So you have the policy before you. Had an opportunity to review it and be glad to answer any questions. You're welcome to vote on it.
Okay, discussion's open, Ralph.
Madam Chair, thank you. And Russ, thank you for putting this together. We did talk and and I thought it was, I didn't, but my staff in my other jobs will be happy that I didn't make any changes to the way you drafted it, because I tend to make a lot of changes. So I just think this is really important, and I think we've heard it today from our testimony. The main thing that the main reason that I want this is an extra layer of oversight. One of the people who testified today said that it would be good for families, for children, for the people of Idaho to just have an extra layer of oversight from what the CDC continues to present to us. And I talked a little bit about this at the last meeting, but to me, I've been questioning a lot of the things that are coming out of CDC because they seem to be more motivated by politics and by pressure than they are by the actual science. I think there's a lot of scientists that are disagreeing with some of the things that the CDC is saying, but just last month, this was shocking, but not surprising to me. The CDC reports fewer COVID-19 pediatric deaths after data correction. And I saw that, and every single headline that I read said, you know, I assumed it was just a small correction. It was 24% correction in the number of deaths, in a number that was already super low, that we knew that children, thankfully, were not being harmed by this pandemic as much as adults. And mostly, as we know, it's people who have comorbidities. It's people who are obese, people who are not healthy, people who are the ones that are really being affected, people who have diabetes that are being affected by this. And children, thankfully, are not being as affected. And I think we had a lot of hysteria in the United States. And this board, frankly, responded to it appropriately at the time because we didn't know what the truth was. We didn't know what was really happening. I remember spending the first month of the pandemic thinking I was going to die, you know, and I think a lot of people thought the same thing, that everyone was going to be affected at first. But now that we have new data, and now that we understand that the science is not quite as strong on children, I think this board needs to make sure that before we make a recommendation to the school districts and to the people of our communities, that we actually review not just the CDC recommendations, but also what other health experts are saying. And I know I always get these beautiful love letters in the comments to the board, but there was one who said, why do you want to suppress facts and put their own interest, you know, meaning my own interest ahead of my children, out of their own children? I have 5 kids. I have 2 grandkids. I have 1 grandchild on the way. I want to put the health of my kids and my grandkids ahead of anybody else's political agenda. And I want to make sure that we have the facts that we're actually determining facts here, that we're looking at all the data that's available. And I think it's really important. And what I commend you on this, the way you drafted it, and I think it's important for the whole board to understand, we're not saying that we're going to reject everything that CDC is recommending. We're just going to be the oversight board. That's what we're supposed to be. We're going to, before we make a recommendation to the schools, before we make a recommendation to parents, we're just going to review all the data that's available, and then we're going to vote on it. So I thank you for helping us with this.
Madam Chair.
Yes, Megan, go
So
ahead.
I make a motion to approve the policy as presented.
Second.
Okay. The motion has been made and seconded to approve the policy as presented. Any further discussion before I call for a vote? Okay, starting with Ada County, Dr. Young. Raul Labrador.
Aye.
Dr. Cole.
Aye.
Commissioner Sturm.
Aye.
Representative Blanksma.
Aye.
Commissioner Hasbrook.
No.
Okay, the ayes have it. So the policy for COVID guidance for people under age 18 is accepted as presented. Thank you, Russ. So,
The second component of that.
yes, yes, yes. I'm sorry.
That's okay.
I'm sorry.
Could have went on business director's report, but
Right.
so I want to make sure I'm clear and fair in what I'm asking. I don't want to ask the board beyond what you think is reasonable, but what would be helpful for me is if you have some specific topics that you would want us to, our staff to come and present to you at the next meeting, which is the May 20th meeting. It would be easier, be more helpful if I can kind of narrow that down. So school, right now we have school guidance, and school guidance would include when we're in substantial or high transmission that kids and staff would wear masks. So that's a CDC recommendation, and we provided that to the community. So that would be one that I assume is high on the list. What else is there that you're hearing from your constituents or that you want us to bring to you?
Madam Chair?
Yes, Ron?
I have a question, so I don't know the answer to this question. Have we made a recommendation on vaccine for children under 18?
Madam Chair?
Go ahead, Russ.
So we would recommend whatever the advisory committee on immunization practices would recommend. So they currently recommend vaccines and doses and certain schedules. So we would provide that information to the community. We would make those same recommendations.
Okay. And
Madam Chair, Dr. Cole.
Yes, Dr. Cole, go ahead.
I will provide, I put in the chat for the board here over 1,000 papers that are actually peer-reviewed scientific papers concerning both the masks, these experimental shots that are not vaccines. We keep acquiescing to that term. They don't prevent acquisition, transmission, disease, or death. And children are mostly, have all had COVID. So I will provide you even more papers before the next meeting. I think it's scientifically actually unethical to be making a shot recommendation and include children in these shots right now. These are not approved. These are emergency authorized. They're still an experiment. They're dangerous technology. I will document all of that for you. And the mask recommendation too, I included a paper in there that has 150 studies on masks showing the non-necessity of them with the respiratory virus. Best thing we can do is have kids wash their hands and stay home when they're sick. All of the hysteria over asymptomatic transmission has been proven false. So I will include a lot of papers there, but I think before the next meeting, these are things, again, this is where the CDC had withheld most of the data from the American people, as the New York Times reported on President's Day in a slow news cycle. So I think this is where science needs to trump political policy, and we need to protect the children. So I will add plenty of material for the perusal of anybody who wants it. So thank you very much.
Thank you. Rebel, did you have something to say?
I did, but I forgot.
Whoops.
That's okay.
He just expedited the meeting.
Yes.
Okay.
So we have two topics for May: childhood vaccine, COVID vaccine recommendations, and school COVID guidance mitigation. It's more broad than just masking. So I'll bring that down.
Oh, so close.
So close. Is the health department doing ads recommending children get vaccinated, number one? And is there a specific guidance for the schools to actually encourage the kids to get their shots?
I'd have to defer that to Gina as far as the specific things we're doing.
Yeah, so it falls under the advisory committee for immunization practices, and so it's a communication with the schools. We had a fluctuation at the time during our school immunization and flu clinics. It was really up to the discretion of the schools to say that we did bring it with us. At the time, those were eligible, but we also had school districts who chose not to have us bring it on site, and we just honored the but we didn't make a recommendation. We don't sit in the communications. It's just a county conversation with the school nurse. I think only one district that chose to have, actually two school districts chose to not have it.
Madam Chair, so I would like to have some information on what we're recommending, again, to people under 18. Vis-a-vis the COVID, and whether we're advertising things like that.
Okay.
I second that. Could we get maybe something emailed out to all of us with all of our current recommendations for children under 18?
COVID vaccines.
Yeah, COVID wise, yep.
Yep.
And then that way we can all look at it and see what are the recommendations.
Okay, any further discussion before we move on to Russ's report? Hearing none, Russ, the floor is yours.
Okay. So I just have a couple of quick items. One we've already covered, which is the budget hearing rotates around to each of the counties. Commissioner Twilliger would be the chair. Or on in my communication with him, after we decided to have it be in Horseshoe Bend, realized you were no longer the chair. And I know this is logistics there, and he's from the Idaho City area, which is where we've always had the Boise County budget hearings in the past. And he said, that's fine. And he may delegate it to you. So I don't know how it'll turn out.
Yeah.
So
Yeah, so we, as commissioners know, we can realign the board whenever we want. I decided to step down as chair while I ran for my reelection. And so I just happened to time that in a really good fashion. And so he got his first public hearing over a cell phone tower and this all at the same time, after I had already set it up to be in Horseshoe Bend. So we'll see what happens if he delegates it to me or not.
yeah, and that happens. And I know even other counties may even delegate it to a non-commissioner if they're not planning to, because we rotate them around and you're driving from Elmore County to Valley County. But anyway, it'll be at the city hall. You'll get more information about that closer to the meeting time. And we started at 10 a.m. just because of all the extra travel. Not that our rural counties don't have to travel for every meeting to hear it, but nonetheless, we're doing it at 10 a.m. On the 20th. And it's a Friday, and the board meeting will immediately follow that. The budget committee meetings are usually pretty brief.
Sorry, what was that date again?
May 20th, Friday, 10 a.m. Where's you been? City Hall.
The big
It's
speed limits.
on the east side as you're going down the main drag, and if you miss it, it's just turn around and
Yeah.
you won't have to drive very
You
far.
shouldn't be able to miss it anymore. We got a nice big metal sign that was fabricated that says it right there
All right.
on the highway. I will not be at that meeting, so he can't delegate it to me. I
Okay.
just realized that my annual fishing trip is that weekend. So I will be in the Oregon coast.
And I think I'm going with you.
Yeah.
So it's-
Good trip for me.
Right?
We'll be calling from Oregon.
Yes.
Yeah. We'll be near shore, so we'll still have phone service.
And what's that?
East side of the road is right.
The right. Yeah, as you're heading north.
Kind of right across from the school.
Oh, okay.
Hmm?
And you kind of right across before you get to the school,
Not even close.
where the courtroom is.
Well, it's not a courtroom.
Used to have court in that kind of a trailer.
Yeah, we did, but we don't do that no more.
Oh, where is it now?
So in Idaho City only.
Oh,
So don't get a ticket on 55.
Yeah.
You will end up in Idaho City regardless.
Yeah.
Fair warning to all people driving through, and our sheriff is cracking down on it.
There was
No.
more to crack down.
Yeah, we got a deputy parked right there 24/7 now. If
Yeah.
you're going over 25 in Horseshoe Bend, you're getting a ticket, I promise. So it's actually where the fire department is. The fire department, the park, and the
Oh,
city
across
hall
the-
are all right there.
across the railroad tracks. to
Yep,
the
right across the railroad track. So if you ever see Mustang towing on your left, look right. And it's right there on your right-hand side is City Hall, right in the park. If you hit Ray's Corner Market, you went too far. Turn around and go back a block.
End up in Cascade, you have a serious problem.
Yeah. See a sign that says, "Welcome to Banks," you've gone way
You've
too
gone
far.
way too far.
Yeah. And there is Wi-Fi there, and they do actually have, so they use some of their COVID funds, the city of Horseshoe Bend did, and their room is Zoom capable.
Okay.
So they can, I don't think they got it set up where people can testify over Zoom, but you can watch the meeting.
Good know.
Madam Chair, can I ask a real quick question? Dr. Cole here.
Yes, go
I
ahead.
will be in, I will be in London for a World Council on Health meeting that day. So will I be able to participate through Zoom or not? Or should I send my comments in beforehand?
Should be able to participate.
Okay.
I can double check. Dr. Cole, I'll double check with the Horseshoe Bend City Hall and verify that. You should be able to, participate fully.
Okay, thank you.
And I'll just let you know.
And then we're gonna
Thank
have
you.
a meeting afterwards, correct?
Yeah.
Right, for the budget committee,
Right.
which won't involve Commissioner Sturm, because he might be able to join from the vote.
No, Steve will have to do it. He don't have no choice.
Okay.
You want to be chairman?
There you go. Yeah, so I think it should work. And then we have the meeting, so Dr. Cole will be able to join the board meeting. So we'll start at 10 a.m. Again, historically, the budget committee last few minutes, and then the board meeting will convene after that. One of the agenda items will be to review the COVID vaccine guidance for the impacts minors, the two specific areas that we talked about. So one other thing.
That's at 10 a.m. then, not at our usual 8:30?
Right.
Okay. Thank you.
And in theory, you wouldn't have to arrive until the board meeting starts, but be there at 10 because the board meeting might start at 10:05. Okay, if we get started on time. The budget committee meeting.
And then I can't get back through the construction until 2.
Come to Boise.
I guess I'll have to.
Stay in Boise County. So.
Take a nap in the truck.
Yeah, you could. There's a lot of options. Nice time of year. Should be.
Rent an Airbnb from the Riverside.
I'll sleep in the truck.
So the only other thing I have is we have Laurel presented the cash balance statement, and we're ending up heading down kind of that same path. And I know and this is something I'll continue to talk to you about, is we have one-time money that's available because people like me charge my time to COVID grants. So what I would like to do, and like to do it before the end of this fiscal year, and I'll explain why, is give our staff what would be a temporary, basically incentive. So increase their pay for 3 pay periods. It'll help draw down some of that money. It's one time. It's not a bonus. Bonuses get taxed at a different rate, but what I'd be looking at doing to do is do that over a 3 pay periods, and increase people's salary. It'd be temporary. We communicate that to all them. So that's what I plan to do, unless there's opposition to do that. It's coming out of this year's budget, not next year's budget. It's one-time funding, and it will make a very small dent in the amount of money we'd have to carry over based on what I just described.
And then after 3 months, depending
3
on
pay periods.
If this budget gets approved, then it would continue, or we would have to reauthorize it.
So this budget, if the 3% is approved, will be permanent, ongoing merit-based increases consistent with the structure I presented to you today. The 3 options, but obviously the 3% option is on there. And to Raul's point, I'll work with Laurel and work with Bailey and try to figure out, I mean, you just don't want to commit yourself, like we talked, to ongoing cost. And if you increase somebody's salary, that's an ongoing liability. And that's what's really, it's not a bad situation we're in to have money. We never have had money like we have now. But that money, in my opinion, it should be used for ongoing, forever obligations, which as staff salaries, although part of that conversation was too, we do make adjustments over time because people leave. You can bring people in at lower salary rates, just like I think what you talked about at the county. So that's what I like to do unless there's any opposition. That's the last thing I have.
Madam Chair,
Yes, Megan.
I appreciate that there are tax consequences to doing a bonus, but I just think that that would look a lot cleaner. Is to do a bonus rather than to increase salaries for 3 pay periods. Just if you want an opinion.
So the tax consequences to the employee. So obviously at the end of the year, when you do your taxes, it's a wash. It's just it's increased at a higher rate, so they get less money in their paychecks today as compared. So that was the strategy behind that. So that we get more take-home pay now rather than the return at next spring.
Madam Chair, I just think it looks cleaner. I just, from an accounting perspective, that we are providing, and it makes it very visible and very clear that it's a one-time bonus instead of being any sort of increase in salary. And I just say that because of my continued nervousness about building things into a budget that then continues unless you're constantly watching them. And I know you have no intention of doing that. It's just from an accounting perspective, I think it looks much cleaner to provide a bonus.
We'll do it.
And I think, Russ, this should probably be in the agenda as an action item. We should all approve this so it's in the minutes. So that protects you if something comes back on an audit.
Okay. We can,
and you could just do it for the last 2 pay periods if we can't get it done.
or one time.
Or one time.
So we could get it done. I'll present that in May. Separate from the budget, right? That's separate because that's the county's, not you all. You've done your part, and we'd include that and get it paid out this fiscal year.
Madam Chair, I have one more question too. Since we passed this budget, Laura, you're going to come out with new numbers for the county
are.
here.
Yes,
And as soon as you can get us those numbers, because we're doing budgets right now, the sooner the better for the counties.
We have the 3% balance
But it's not in
budget.
here.
It's not in your packet. We can send that out by the end of the day today. It's ready to go. We had all of them
Okay.
ready as requested.
Great.
We'll have to make just a couple of tweaks with the cost of the salary increase, but we left, everything else is balanced, so you should have that by the end of the day today.
Thank you.
Great, thank you.
Anything else? Okay, this brings us to the conclusion of our meeting agenda for today. I would like to express appreciation to the public that has shown this remotely for their participation. And with that in mind, I will call for a motion for adjournment.
I'll second.
Okay, it has been moved and seconded. We adjourn the meeting for today. No more discussion about any items. Okay, we'll go roll call by county. Jane Young.
Aye.
Raul Labrador.
Aye.
Dr. Cole.
Aye.
Boise County Commissioner Sturm.
Aye.
Elmore County Representative Blanksville.
Aye.
Valley County Commissioner Hasbrook.
Aye.
Okay, the meeting has been adjourned and have a good day. Thank you.
Thank you. So Megan, Dr. Young had a question for me that I didn't know how to answer. Maybe your help can answer.